Imagine sitting next to someone who's coughing and sneezing. Suddenly, it hits you. Are you breathing in something dangerous? Airborne diseases are a hidden threat we face every day, especially when germs are floating around, just waiting to find a new host. But don't panic. Today, we'll break down what airborne diseases are, how they spread, and most importantly, what you can do to protect yourself and others. Section 1. What are airborne diseases? Airborne diseases are infections that pass from one person to another through the air. This could happen when someone with an infection coughs, sneezes, or even just breathes. Microorganisms like viruses, bacteria, and fungi can linger in tiny droplets in the air, making them easy to inhale. Diseases like the common cold, chickenpox, and even COVID-19 are all spread through the air. These diseases can make you feel like you've been hit by a truck, with symptoms ranging from minor sniffles to serious health problems. Each one has its own specific effects, but the way they spread is what makes them especially tricky. Section 2. How do airborne diseases spread? When someone coughs or sneezes, they release droplets into the air that carry pathogens. These droplets can be as small as a fraction of a millimeter, meaning they can hang in the air for a long time, depending on conditions like temperature, humidity, and airflow. Picture it like this: those droplets are like invisible dust, floating around and waiting to be breathed in. There's even a type of droplet that's even sneakier, called droplet nuclei. These tiny bits dry out almost instantly, leaving behind particles that can float around in the air indefinitely. They're like tiny hitchhikers, waiting for someone else to come along and breathe them in. Section 3. Where do these pathogens come from? Airborne pathogens can come from various sources. Some of these come directly from an infected person or animal, but others are found in our environment. For instance, a fungus called Aspergillus is everywhere: soil, plants, household dust, even in building materials. If you're near construction work, it's easy to breathe in this fungus just because it's disturbed and goes airborne. Similarly, anthrax spores exist naturally in the soil. You may have heard of anthrax in the context of bioterrorism, but it's also something that occurs in nature. If dust forms from anthrax-infected soil, inhaling it can lead to serious illness. Section 4. Factors that influence airborne disease spread. Several factors influence how long these particles stay in the air and how far they travel. 1. Temperature and humidity. Cold, dry air keeps particles floating longer, while warm, humid air can make them settle faster. 2. Air currents. Imagine a sneeze that's carried by a gust of wind. It can move those particles far beyond the sneezer's immediate area. 3. Sunlight exposure. Some germs break down when exposed to UV light. Sunlight can help reduce the time they remain infectious. These factors mean that when the right conditions align, airborne diseases can spread more effectively, traveling distances and lingering longer. Section 5. Types of airborne diseases. Now, let's look at some common airborne diseases and the symptoms you might expect. 1. Common cold, caused by rhinoviruses. It brings on sneezing, runny noses, and sore throats. 2. Chickenpox. The itchy, red rash and fever are caused by the varicella zoster virus. 3. Measles and mumps. These come from paramyxoviruses, causing symptoms like high fever, rashes, and swollen glands. 4. COVID-19, caused by SARS-CoV-2. This virus can cause fever, cough, and even severe respiratory issues. 5. Tuberculosis, TB, a bacterial infection that targets the lungs, leading to cough, fever, and night sweats. Some of these, like the common cold, may just be inconvenient, but others, like TB or COVID-19, can be life-threatening. Each airborne disease has unique symptoms and treatments, so understanding them can help you recognize if you or someone you know might be at risk. Section 6. Prevention and protection. While we can't completely avoid all airborne diseases, there are many ways to lower the risk. 1. Use personal protective equipment. PPE, masks, especially N95 respirators, help filter out many airborne particles. They're a must in high-risk settings. 2. Ventilate indoor spaces. Good ventilation keeps air moving, reducing the concentration of pathogens. If you can, open windows or use fans to circulate fresh air. 3. Cover your mouth and nose. When you cough or sneeze, cover up to stop the spread of droplets. You can use your elbow or a tissue, just don't use your hands. 4. Stay home if you're sick. If you feel unwell, avoid public places to prevent spreading your germs. 5. Properly maintain ventilation systems. Regular cleaning and servicing can prevent buildup of dust or pathogens, especially in hospitals and other health facilities. In hospitals, strict ventilation protocols and specialized equipment like HEPA filters protect both patients and staff from harmful pathogens. It's a constant effort to keep the air as clean and pathogen-free as possible. Section 7, Treatment and Outlook. Treatment depends on the type of disease. Bacterial infections, antibiotics can often help, but with some bacteria like Mycobacterium tuberculosis, resistance is making treatment more challenging. Viral infections, antiviral drugs can slow down some viruses, but there's no cure. Vaccines, however, are a powerful way to prevent severe illness. Fungal infections, these often require antifungal medications, which can target and kill the offending organisms. Diseases like the common cold typically clear up on their own, but others, like COVID-19, can lead to long-term complications. Taking preventative measures can not only help avoid infection but also stop the spread of these diseases to others who may be more vulnerable. Conclusion. Airborne diseases may be invisible, but they're a very real part of our world. Understanding how they spread, where they come from, and how we can protect ourselves is key to staying safe. Remember, small steps like wearing a mask, keeping spaces ventilated, and practicing good hygiene can make a big difference. As we continue to learn more about these invisible threats, stay informed, stay protected, and stay proactive. By being mindful of airborne diseases and how they work, you can keep yourself and those around you healthier every day. With this knowledge, you're now better equipped to handle the risks. Remember, it's not about living in fear, it's about being aware, informed, and prepared. Stay safe out there.
You